factor number 10. Does anyone know the answer to the ultimate question out there? Anybody? 42. Yes, I heard it over here. The Hitchhiker's Guide to the Galaxy, that's where that came from. We want to find the meaning in what we do. And we already talked about this a little bit. But again, our work, you can view work in one of 3 different ways. You can view it as a job, something you do for the money. You can view it as a career. That's something that you do for advancement opportunities. Or you can view it as a calling. And a calling is something you do because you believe in it, because of the impact that it makes. And we're really lucky because studies do show that people who view their work as a calling are happier. And we are all here because we were called to veterinary medicine. Unfortunately, I do know a lot of veterinarians who've been out for a while who no longer view it as a calling. They view it as a career or a job because they've gotten burned out and they're dealing with compassion fatigue and all sorts of problems. But right now it's a calling, and we need to try to hold on to that. So I want you to remember your why. You guys are all full of why right now. Hold on to that. Remember why you're here, write it down on a piece of paper, put it somewhere, so that when you get out into practice and you're having a bad day and you're wondering if you made a mistake, you can pull it out and you can look at it and you can remember why you're doing this. And you need to choose not to be a victim, right? Bad things are going to happen in this job. And we can ask, why me? Or we can ask questions like, what? What have I learned from this experience? What can I do to teach others so that they don't have to go through this experience? How can I make a difference, right? So we talked about Dr. Jessica Wilson before. She didn't just, after her experience, turn to physical fitness. She made a platform so that she could promote that to others. And she took her story and her experience and she used it to help the veterinary profession as a whole, right? She was not a victim in that moment. She was trapped in her body and she couldn't move, and she said, I am not going to be a victim. So those are the 10 factors, but is it all up to us, right? Do we really have to do all the work to work on those factors? That's a lot of things to work on. Most of us can pick maybe 1 or 2 at a time to concentrate on, right? But guess what? If we picked 1 or 2 factors to work on, there was a lot of overlap, right? How many times did we talk about meaning, about altruism, about a bunch of different things, that social support that just crossed from one to the other, right? But some of us are not in a place to make these changes, right? There are people out there who are suffering from mental illness that are not able to utilize these skills. Right? We see this in our patients. When we have dogs who have severe phobias, they're not amenable to positive reinforcement and behavioral modification. And so we have to give them medication to put their brains in a place where they're not so aroused that they can't respond. Mental illness can affect us the same way. Right? Again, lack of resources. Not everyone has the resources to get through. Injury, right? But social support is one of the most important factors that we talked about. And that means that we can help each other. So what can you do? Well, you can reach out to a struggling colleague. I strongly recommend that everyone look into QPR training. That stands for Question, Persuade, and Refer. It's basically CPR for suicidal ideation. It teaches you how to recognize the signs, because people who are struggling often can't reach out themselves.